Okay, well, welcome to our COVID-19 interview series, Rising to Meet the Moment, where we're going to be discussing different aspects of how the behavioral health system is responding to COVID-19 and rising to meet the moment of all Californians. I'm Jessica Cruz. I'm the CEO of NAMI California and the co-chair of the Behavioral Health Action Coalition, where our mission is to engage California's leaders in behavioral health issues and reducing stigma. And I'm here today with my co-chair and the CEO and president of the California Hospital Association, Carmela Coyle.
Thanks so much, Jessica, and it's great to see you. And we are so pleased today because we are joined by Dr. Nadine Burke Harris. Dr. Burke Harris is an award-winning physician. She's a researcher, she's an advocate, and she is the first and current Surgeon General of the nation-state of California. And we are so pleased to have Dr. Burke Harris with us today because in addition to everything else that she is and does, she is an expert on issues of behavioral health, and particularly on the issues of toxic stress and adverse childhood events. So Dr. Burke Harris, thank you so much for joining us today for this interview.
Oh, it's my pleasure. It's great to see both of you again.
Thank you so much. Since the last time that we talked together in April, the COVID-19 pandemic has obviously taken its toll, not only in terms of being a public health and an economic crisis here in the state of California, but it's clearly affected people's health. And it's affected how we interact with one another, our families, our friends, our neighbors. Could you talk a little bit about how you think this COVID crisis has affected California's behavioral health?
Yeah, I think undoubtedly it has an effect on our behavioral health. And one of the things that I like to say to folks is if it feels hard, it's because it is hard. You know, we are in a once in 100 years pandemic, which is, you know, has created a once in 75 years economic downturn. And there's a lot going on right now. We're experiencing, you know, a once in 50 years level of civic uprising in terms of addressing, you know, fundamental civic rights issues, human rights issues, racism in our nation. And so there's so much that's happening now. And we recognize that it does affect people's health and their well-being. And the other part of it that's really challenging is that because of the necessary measures that we need to put in place to prevent the spread of COVID-19, right? We also are not able to engage, or less able, I will say, to engage in many of the factors that are documented and demonstrated to help us to be able to recover from stressful situations. Things like engaging, spending time with friends and family and loved ones who ultimately can be that connection and buffer to our stress. So now is a really, really challenging time. And, you know, one of the things my office has done to respond to that was to create the Surgeon General's playbook for stress relief during COVID-19. And it's really just employing some of our evidence-based strategies around how we can reach out to others, even if it's not in person, connecting with our trusted friends and relationships through, you know, by phone or by video or, you know, across the way in safe distances, right? All of that is really important. Getting that regular exercise, really important right now. And doing things like, you know, mindfulness or meditation. And, you know, if there's ever a time to reach out to a mental health provider, now would be the time. Right. And so this is one of the things that we put in the Surgeon General's playbook, is that getting mental health care is an important part of the way that we care for our health and well-being right now.
Thank you.
And, you know, even since we talked in April, so much has changed. You know, we now know that our kids are not going to be going back into the classroom for the most part in the fall. Many people are still working from home, and others have been furloughed or even lost their jobs. So can you tell me about all of this you know, the upheaval and the devastation, and how it's affecting our mental health, but most specifically, you signed on to a letter with the Department of Healthcare Services on the suicide screening. Can you tell us a little bit more about that? And then broadly, how the changes affect our stress level, both at the short term and also at the long term?
Yeah. So we were very pleased to collaborate with the Department of Healthcare Services and the California Department of Public Health to send out a letter encouraging providers and giving guidance and resources for providers to screen patients for risk of suicide, right? And that is something that providers should really have a strong sense and a skill set around how to do anyways. We know that this is an important part of providing, you know, comprehensive care. And at the same time, it's never been more important than now during this you know, critical period that we're in right now. And so it was really important for us to be able to share those resources, those best practices, with providers and encourage them about the importance of screening for risk of suicide. What we know is that the effects of stress on health are multiple, right? They affect our physical health, they affect our mental and behavioral health. And one of the ways that this happens, we see on the research, right? The research that comes from around the biology of stress and how it impacts health, right? Is that when we feel a stressor, it releases stress hormones in our bodies. And those stress hormones affect the way that our brains work. They actually affect our cardiovascular system, our immune system, our hormone system, you know, all of the way our whole brains and bodies work. But one of the most common ways in which that can show up is in our mental and behavioral health, right? And so actually, you know, what the research shows, a lot of the work that I've done has been on the impact of early adversity, so childhood adversity, what we call adverse childhood experiences, and that an individual who has had 4 or more adverse childhood experiences is more than 30 times as likely to subsequently attempt suicide as an individual who has 0 adverse childhood experiences. So we know a history of exposure to stressors is can also increase the risk that someone may have a negative mental health, behavioral, or even physical outcome later on down the line. And that's why it's so important for healthcare providers, right, to be screening and for families to have access to quality, accessible behavioral health.
So you had mentioned a little bit about your passion and your work and your research behind ACEs. Can you just tell us a little bit about how all of these changes are influencing your thinking on ACEs framework and some of the research?
Yeah, it's incredibly timely that the state of California really took a leadership role in responding to adverse childhood experiences as a public health threat. Right, and by launching the ACEs Aware initiative, which was launched in January of 2020, to train our providers how to screen for ACEs, adverse childhood experiences, how to identify someone is at risk of having a toxic stress biology, and then how to respond with trauma-informed care. Now, in the context of the pandemic, the economic downturn, everything that we're experiencing, what we see is that having a trauma-informed workforce has never been more important, right? Because we see that COVID-19 is not only directly increasing ACEs by increasing the number of folks, for example, who are having mental health exacerbations or decompensation, who are having substance use or dependent, issues with substance use or dependence. And then we've also unfortunately seen that rates of things like intimate partner violence are going up, right? So these are among the ACEs criteria. We know that ACEs themselves, the data shows, are likely to be increasing right now. But again, recognizing that the risk for toxic stress, the ways in which our body, the stress gets under our skin and changes our biology, is also in part has to do with inadequate buffering caregiving systems, right? And that's the other thing that we're seeing with the pandemic and the economic downturn, is making it more difficult for kids and adults to get the adequate buffering care that they need. And so we are really thrilled that the ACEs Aware initiative offers these resources to providers on how to screen and how to respond with trauma-informed care. And in addition, in April of this year, we sent out an all-plan letter. The Department of Healthcare Services, the Department of Managed Healthcare, sent out a letter to all of our health plans and our providers about recognizing the effects that the stress of the pandemic may be having, both on youth and on adults, right? And how we all need to respond with trauma-informed care and know what to look for in our patients as to what these secondary impacts of COVID-19 might look like. So there's a lot there. Those resources are available at acesaware.org. And similarly, we have more resources available around statewide resources at covid19.ca.gov.
Perfect, thank you.
And so let me pick up right there with this conversation around stressors. As if a COVID-19 pandemic is not enough, as you mentioned earlier, we are dealing with some of the most tumultuous civil rights activity that we've seen in decades. The Black Lives Matter protests and marches following the killing of George Floyd. Talk a little bit, if you can, about the impact that all of that in this environment, the images that we're all seeing, how that affects our behavioral health, and what more we should be doing as Californians.
So I'm really glad that you mentioned that. It's something that is really powerfully affecting a lot of people right now. For starters, I think that for anyone who watched the George Floyd video, it's extremely difficult to watch, but certainly I know many people really experience vicarious trauma simply from witnessing what transpired in the video and the killing of this fairly young man. And in addition, that we recognize that one of the things that we talk about as part of the ACEs Aware initiative, and it kind of sometimes doesn't get as much press, is around racism as a risk factor for toxic stress. We have decades of research, and in fact, hundreds of years of research that clearly shows how discrimination and systemic and structural racism impacts the health outcomes of the communities that are affected. And we're seeing this right now with COVID-19. We're seeing right now, increased morbidity and mortality, right? Disease and death in our communities of color. And so when we think about what more we can be doing, there is a tremendous amount that we all can be doing. So both within the healthcare sector, helping providers recognize racism as a risk factor for toxic stress, also helping providers recognize the ways in which implicit bias affects the healthcare that we deliver, and making sure that we are delivering the highest quality of care and evidence-based care. But we also recognize that no amount of clinical protocols, right, or clinical care that we deliver is going to, fully address the problem. we have to address the systemic and structural racism that have been embedded in the structure of American society since its inception. And it's incumbent upon all of us to be part of dismantling these systems, because we have to recognize that they are leading to disease and death. Right? And so it's up to all of us. This is an urgent imperative. And whether it's in your workplace, in your, you know, where your kids are going to school, if it's showing up to the ballot box come November, right? All of these are really important. There's something that there's an important role that every single one of us has to play in dismantling systemic and structural racism.
And it's hard, but how do we create that common vocabulary that allows us to have the conversation as well? Yeah. Thank you.
And I would love to hear from you about how you see not only that they should be seen as the same, but how your mental health can also impact your physical health.
Yeah, you know, that's always been a curiosity for me, because we all know that the body doesn't stop at the neck, right? Like somehow we've set up our, you know, healthcare systems as if that were what happens. But increasingly the science shows that that is such an artificial designation, and that what impacts, you know, what affects our physical health also affects our mental and behavioral health, and vice versa. And I think increasingly we're all understanding that mental and behavioral health is health, right? Just, you know, full stop. And I think one of the pieces about that that's really important is a recognition that when we think about preventive health as well, we want to be thinking about our mental and behavioral health also from that preventive lens, right? So, you know, we want to recognize that all of the pieces that we're talking about when we're talking about prevention, early identification, early intervention, all of those are equally as important with our mental and behavioral health as it is with our, you know, I don't know how I don't view it as separate. So, but you know, what we think about as traditional or physical health, because, you know, increasingly what the science shows is that, you know, when we see these strong relationships between things like depression and heart disease, right? Or we see that chronic illness like chronic inflammation can impact our mental health outcomes, right? We now recognize that the mind and the body are together. They're one and the same.
Yeah. Well, thank you so much, Dr. Burke Harris, for joining us and sharing all of your insights and your passion again with us. We are looking forward to working side by side with you and continuing along this journey, making sure that all Californians have access to behavioral health services and that we're reducing stigma. So we appreciate you and your time with the Behavioral Health Action Coalition. Thank you on behalf of both of us, Carmela and myself. We so appreciate you being here. And Rising to Meet the Moment is a production of the Behavioral Health Action, a coalition of more than 50 statewide organizations united to raise awareness on behavioral health issues in California. Thank you so much.